Hello, my name is Dr. Joseph Daniel. I'm a board-certified plastic surgeon in Greenville, Delaware, approximately 40 minutes from Philadelphia and just a few minutes from downtown Wilmington. What we're going to do today is talk about abdominoplasty. We'll talk about women who are good candidates, women who are not. We'll have a little aside about liposuction and other techniques to improve the abdomen. So typically a woman who comes in for abdominoplasty has had children. It's preferred to do abdominoplasties after children are generally not going to be planned. Childbirth tends to produce excess skin, muscle bulging, stretch marks. Sometimes there's some residual fat that hasn't been able to be lost. And these are great reasons for abdominoplasty. Other reasons are significant weight loss. Some patients have had even 100 or 200 pound weight loss, for instance, with a gastric bypass, and not had children. And those patients are also great candidates for abdominoplasty. And then some patients have had neither and for whatever reason have excess skin or stretch marks and want to have as improved abdominal appearance as possible. There's a big distinction between abdominoplasty and liposuction. Abdominoplasty, otherwise known as tummy tuck, is where we use a long incision to remove skin that generally goes from one hip to the other, up around the belly button, and then down along the pubic hairline. And what that is doing obviously is removing the extra skin that's been developed. It's removing the overhanging skin that can turn over clothing or fold over on itself. Through that incision we're able to tighten the muscles all the way up to the xiphoid process here at the top of the rib cage. I'm sorry, bottom of the rib cage. And then generally liposuction to the flanks and to the upper abdomen and the opposite flank. Now liposuction is completely opposite. It's small incisions that are generally invisible, and the idea is to remove fat only. And so if you have extra skin, stretch marks, overhanging skin, bulging muscles, liposuction is probably not the best operation. Liposuction is best for women or men who who have good skin tone, who are generally not overweight or not significantly overweight, and just need to have the overall fat layer thinned slightly. So abdominoplasty is generally about a 2-hour surgery. It's done at the hospital. Most women prefer to have an overnight stay. Overnight stay helps with pain control. Sometimes there's some nausea, dressing changes, etc. However, medically it's not absolutely necessary, and if you prefer to recover at home, then that's fine too. I do 2 styles of abdominoplasty, a drainless technique or use of a drain. Drainless technique is where the tissue that's been elevated and then pulled down like a blind has been separated from its tissues, and by suturing or stitching those tissues back down to the muscle, there's no more space for fluid to accumulate, and you have an instant seal, and therefore no drain hanging out from the corners of your incision. Sometimes, however, a drain is necessary, particularly with significant weight loss patients, patients who have very large incisions, large amount of liposuction, etc. Now, abdominoplasty is also known, or it can be made into a less invasive procedure or a smaller scar variety, and that's called a mini abdominoplasty. The mini abdominoplasty, instead of removing the skin from hip to belly button to hip the hairline basically removes it from halfway between the belly button and hair. So basically it's treating the lower abdomen. There's very little to the upper abdomen. It's not able to tighten the muscles of the upper abdomen, and the incision is shorter. However, it's only slightly shorter. Perhaps it's about 3/4 as long as a full abdominoplasty. However, there is no scar around the belly button. Pain is less, recovery is less, and sometimes it is the preferred method. So, just like just like breast augmentation, abdominoplasty is also considered a very painful procedure. I use the On-Q pain pump, which is a ball of numbing medicine with 2 catheters that go under the muscle repair, helps numb the stitching of the muscles, which tends to be the most painful, and significantly reduces pain. That device is typically removed by the patient at home around the 3rd or 4th post-op day. At the end of the procedure, you're provided a surgical garment that basically wraps around as a Velcro-style binder, and that binder is worn for roughly 2 to 3 weeks to add comfort, provide gentle compression to help minimize swelling, and help you get up and moving around better. Most women do tend to be fairly slow moving and guarded in their daily activity for the first week. I like to say that they walk around the house like an old lady. Usually by the 7th or 10th day, patients are fully upright, walking quite normally. Typically you're still taking pain medicine, particularly at night, either Vicodin or Percocet, for instance. And by 2 weeks, you're really doing well. You're probably not taking pain medicine anymore. You're up and about. You've been driving for several days, and many women are ready to go back to work. And certainly by 3 weeks, most women can return to work. The final post-op appearance takes about 3 to 4 months to show itself, and that's due to the swelling that is typically present with this type of surgery. Oftentimes other procedures can be added, breast reduction, breast augmentation, thigh lift, whatever. So abdominoplasty does not have to be the only surgery of the day.